corrections and workforce systems. To match job seekers to services in the IRES pilot project. My name is Erica Nelson, and I am a Corrections and Reentry Policy Analyst at the Council of State Governments Justice Center. Before we begin, I have a couple of technical notes. If you encounter connection or audio problems during this webinar, please call WebEx Technical Support at 1-866-229-3239. We have also posted the number in the chat box on your screen. Unfortunately, there are some connection issues we may not be able to resolve during the webinar. However, we are recording today's webinar and will post to our website along with copies of the slides used in today's presentation. Everyone who's registered for the webinar will receive an email as soon as the webinar is available on our website. You may also check the website directly at csgjusticecenter.org/NRRC. At the end of today's webinar, we will have time for questions from the audience. To ask a question, please enter your question into the Q&A panel on the right-hand corner of your screen. You can answer questions at any point during the webinar, and we'll do our very best to answer as many questions as possible before we end today. Joining me for today's webinar are Deanna Hoskins, Senior Policy Advisor at the Bureau of Justice Assistant, U.S. Department of Justice, Earl Buford, President and CEO of Employ Milwaukee, a local workforce board located in Milwaukee County, Wisconsin, Tamika Cooley, Program Manager at Career Source, Palm Beach County, also a local workforce board located in Palm Beach County, Florida, Neil Thorson, Regional Chief at Wisconsin Department of Corrections, Division of Community Corrections, and Ray Woodruff, Employment Programs Manager at Wisconsin Department of Corrections. Now, I will turn it over to Deanna Hoskins, Senior Policy Advisor with the Bureau of Justice Assistance, U.S. Department of Justice, to talk about our sponsor for today's webinar. Deanna?
Thank you, Erica. This webinar is presented to you by the National Reentry Resource Center, or what we like to call the NRRC. The National Reentry Resource Center is a project of Bureau of Justice Assistance in support with Second Chance Act funding dollars. One of the goals of NRRC is to provide technical and training assistance to all the recipients of the Second Chance Act grant in order for them to maximize their efforts to reduce recidivism and help people succeed in their communities after incarceration. They also work with researchers and practitioners to develop resources and tools that assist jurisdictions in implementing evidence-based, data-driven strategies to reduce recidivism, just as the program you'll hear about today. They also have an online library that contains more than 1,000 publications, reports, and other materials to help the field identify proven and promising practice. One of the things that the NRRC does that is really great, that we really enjoy them doing, is the peer networks and information exchange, bringing peers together to discuss issues, but through monthly webinars such as the one you're having today, to discuss key reentry topics and national training events to facilitate some of that peer-to-peer networking. And also, they provide information for people returning to the communities and their family as they maintain an online state and local reentry directory that help people identify the service providers in their community. The NRRC was established by the Second Chance Act in 2008. To date, the NRRC has supported over 600 Second Chance Act grantees, and for fiscal year 2016, the Bureau of Justice Assistance invested $68 million in Second Chance Act grants, encompassing over 34 new awards to support community supervision, employment training, co-occurring mental health and substance abuse disorders, Reentry and Mentoring Programs, and Statewide Recidivism Reduction Act. To access the NRRC, please visit the Council of State Government Justice Center website and where you can register to receive the monthly updates. I will now pass it over to Erica Nelson to begin the presentation, and again, I thank you for joining us for this webinar.
Thank you, Deanna. Here's the agenda for today's presentation. We'll begin with an overview of the intersection of reentry and employment efforts, which will speak to the key concepts that led to the development of the Integrated Reentry and Employment Strategies, or as we call it, IRES for short, pilot project. Then our panelists will speak to 4 significant lessons learned when implementing a collaborative and coordinated approach to ensure that the right people are connected to the right interventions at the right time in their reentry process. Panelists will speak to engaging key stakeholders and integrating corrections and workforce systems, assessing the risk and needs, including job readiness of the reentry population, inventorying services available, pre- and post-release, and making referrals to those services and tracking outcomes. So let's get started. So we all know that the scope of reentry is too big to ignore. 1 in 37 American adults were under correctional control in 2016. That's about 10 million adults in the U.S. returning from incarceration each year, nearly 600,000 people released from state and federal prisons, and 9 million cycling in and out of local jails. About 74 million adults have an arrest or conviction record nationwide. Okay, everyone, pop quiz. How many working age adults in the U.S. have a felony record? A, 1 million, B, 6 million, C, 15 million. We'll give you about 20 seconds to respond. Okay, has everyone entered in their answer? Now we'll tally the responses. And this will take about 30 seconds. Okay, the results are in, and we have the majority of attendees responding with C, 15 million, and I'm guessing we have some experts here in reentry because that answer is correct. 15 million individuals of working age have a felony record. Thank you for your responses. Okay, I have another question for you. How many people are out of work in the U.S. because of their felony record? A, about 825,000. B, about 1.8 million. C, about 5 million. Please enter your answers. You'll have 20 seconds again to respond. Okay, I hope you've entered in your responses. At this time, we'll do a tally of those responses. And again, this will take about 30 seconds. Okay, the results are in, and majority of those who answered selected C, 5 million, which is not correct. The answer is B, 1.8 million. So 1.8 million are out of work in the U.S. because of their felony record. There's an extensive body of research that has been established that having a felony record or time in prison makes individuals significantly less employable. It is not simply that individuals who commit crimes are less likely to work, but rather that felony convictions or time in prison act independently to lower the employment prospects of ex-offenders. It creates a decline in skills, it minimizes access to pro-social networks, create employer biases, and legal barriers to employment, such as occupational licensing restrictions. I want to thank everybody again for those responses to the pop quizzes. So, and while we know that employment is an important factor in successful reentry, as it creates strong, positive relationships, incomes for families, improved mental health, and so on, especially when the earnings are above minimum wage and the jobs are stable. But we also know that simply placing someone into a job will not prevent reoffending. So how do we break the cycle? In order to break the cycle and see reductions in recidivism for people who are at a higher risk to reoffend, interventions will need to address the criminogenic factors that lead to a person committing a crime, such as antisocial behaviors, in addition to associated needs, such as job readiness or employability. While there have been advancements in both the criminal justice field and strategies to reducing recidivism, and on the other side, in the workforce field, how to improve someone's readiness for work, these advancements have been made largely on parallel tracks with limited coordination. To that extent, in 2013, the Integrated Reentry and Employment Strategies, or IRES for short, white paper was published. We brought together the best minds in corrections, reentry, and workforce development fields to discuss ways by which recidivism reduction interventions could be delivered in the context of employment programming, and how to triage limited resources by targeting services to those who need them the most. We know how we could ensure that people leaving from incarceration were connected to the right types of employment and reentry services at the various points in their reentry planning process. And these are based on their individual risk and associated needs. The IRES framework is heavily based on risk, needs, and responsivity, or as we say, R&R principles. The diagram shown is called the Resource Allocation and Service Matching Tool, which uses validated criminogenic risk and needs assessments, along with job readiness assessments or screenings, to recommend the delivery of targeted employment programming. Because this tool groups people first by risk and then by readiness for work, resources can be most effectively focused where they can be most effective. We'll take a deeper dive into assessment-driven referrals and service delivery later in this presentation. While the principles and practices of the white paper are evidence-based and aligned with corrections, workforce, and community-based, an alignment of corrections, workforce, and community-based agencies hasn't been tested on a systems level. In 2015, 2 pilot sites were selected to test this framework at a systems level: Palm Beach County, Florida, and Milwaukee County, Wisconsin. And more specifically, what we were trying to figure out is what works to make better connections to employment services pre and post-release based on an individual's assessed needs. This is a 3-year project, and the first year ended in March 2016. And it was an opportunity for us to learn about the systems in each site. We conducted data analysis to identify risks and needs of people returning to both counties. We held meetings with correctional institutional staff, community-based employment providers, and supervision agents to understand who was providing what types of services and then how those services were delivered. We reviewed a lot of documentation outlining the processes and procedures for how someone moves through the criminal justice system and back into the community. In May 2016, we presented the findings and recommendations to streamline the reentry planning process to lead stakeholders in both pilot sites. And we quickly began to work with both sites to implement the recommendations proposed. After months of implementation, we learned a lot, and there were 4 key areas we found necessary to implementing a collaborative and coordinated approach to ensure the right people are connected to the most appropriate interventions during various times in their reentry planning process. And those 4 areas were buy-in from leadership, timely risk needs assessments and job readiness screenings, and knowledge of the landscape of employment services, and a coordinated process for making service referrals and tracking data. With that being said, let's take a deeper dive into those 4 areas, starting with engaging key stakeholders. Policymakers and practitioners across the political spectrum at all levels of government recognize the scope and importance of reentry, and employment has been identified as a key reentry issue that must be addressed in order to reduce recidivism and improve public safety. As mentioned before, nationwide, about 40 million adults have an arrest or conviction record. And we know that having a criminal record impacts someone's ability to find and maintain work. So the first question, if you're interested in a collaborative approach, is our leadership committed to a collaborative approach? So what does that look like in practice? Well, it includes involvement from executive leadership to champion the efforts and hold agencies accountable for establishing policies and procedures that will accomplish shared objectives. Executive leaders can also influence the policies or identify different funding streams to support the work. It also includes planning teams. This can be an existing criminal justice coordinating council or a task force that can guide the planning and implementation process. The planning team includes key leaders from criminal justice system and the workforce system and representatives from diverse perspectives. You will also need a designated project coordinator to manage the planning process and ensure that activities associated with systems integration stay on track and that the work gets done. And lastly, you will need everyone on board to be committed to the same vision, mission, and guiding principles. And they will need to be willing to make the necessary agency and system-level changes to achieve those goals. So, how do you get state and local policymakers and key leaders from criminal justice and workforce systems fully invested in reducing recidivism and increasing the job readiness of people returning home after incarceration? Now I'm going to turn it over to Ray Woodruff with the Wisconsin Department of Corrections to talk about engaging leadership in Wisconsin and some of the planning teams that have been developed to support reentry and employment efforts, including the IRES project we're speaking about today. Ray?
Sure, thanks, Erica. So I think if you go back to the beginning, when we look at the possibility of this project, it's important to have leadership all throughout, the agency or multiple agencies that understand the scope of the issue. And fortunately in the state of Wisconsin, and particularly in Milwaukee, we have a strong partnership. We had an existing strong partnership with Employ Milwaukee, the local workforce development board, Department of Corrections, Department of Workforce Development. And at the point that we applied for this opportunity, I think leadership all understood the scope of the issue locally. We released a lot of individuals from incarceration back to Milwaukee County. A lot of individuals are on supervision, community supervision in Milwaukee County. So we knew it was a local issue that we needed to focus on, but we also had state leadership that was focused in this area, that was interested in not only supporting people who are coming out of incarceration, but increasing employment opportunities for people in the community. So in a way, it was like a perfect storm where we had leadership on both sides of the political aisle really come to the table and say we want to support a strategy which is intentional and which supports individuals that are coming out of incarceration. So really to start at the bottom there, I guess, with the Executive Steering Committee, we had leadership from the very top. Our project champion, I guess you'll say, is Lieutenant Governor Rebecca Clayfish, a Republican. And I'll mention their political affiliation because I think it's important to highlight that we have individuals from both sides of the political aisle invested in this project. We have Democratic Senator Lena Taylor, State Senator Lena Taylor. We have Republican State Representative Rob Hutton. We have the Department of Corrections Secretary John Litcher, Department of Workforce Development Secretary Ray Allen. We also have Milwaukee County Executive Chris Abele, a Democrat. And we also have Milwaukee Mayor Tom Barrett, a Democrat, on the Executive Steering Committee for this project, all who signed up right at the beginning to be a part of this project and wanted to support now the Department of Corrections, Employ Milwaukee, Department of Workforce Development, developing a strategy to support all of the individuals who are coming back to the community. So with the Executive Steering Committee in place, we needed to develop a full steering committee or a committee that could really, I guess, review the technical assistance recommendations that were coming from the Council of State Governments and others, and then make decisions as to how the technical assistance plan would work. And so we wanted to get a good cross-section of actors in the community to be a part of this steering committee. So we have several representatives from the Department of Corrections. And just for a bit of clarification for folks who may not know, the Department of Corrections in Wisconsin oversees prisons as well as community supervision. And Neil Thorson will talk about community supervision here shortly, but we had representatives from our Division of Adult Institutions, which is our prisons, community corrections. We had representatives from Department of Workforce Development, of course, Employ Milwaukee. We also had representatives from community-based providers on the steering committee, individuals who are directly working with the population, and we wanted their input as to how are things working, how are referrals working. We have employers on the steering committee, we have training partners on the steering committee, as well as a representative from the U.S. Attorney's Office. So several partners in the local community that could speak to what should we be doing to more appropriately serve the population. And then I think you need, if you're looking at starting something like this in a location throughout the country, I think you need what we call a core planning team. So you need individuals who are really immersed in the work, who are responsible for really keeping any subcommittees on track and really moving the project forward, right? So these are oftentimes people who are actually doing the work and who are able to develop policy and procedures and then sort of take that through the steering committee. So on our core planning team, we have some key members of the Department of Corrections, Department of Workforce Development, Employ Milwaukee, as well as representatives from a few of the community-based providers in the Milwaukee community. And so I think having all of these different committees and structure in place has really helped us to keep on track, as well as to have support at the highest levels, both locally and in the state.
Thank you, Ray, for providing insight on the planning teams in Wisconsin. Engaging leadership in the criminal justice system and workforce development system in a collaborative approach to service delivery can be a challenging task because historically, as I mentioned before, they've operated on separate tracks with limited coordination. American Job Centers, known as one-stop centers, are designed to provide employment and training services throughout the country. Although people returning from incarceration often seeking work, many of the characteristics that make it difficult for them to connect to sustainable employment, such as behavioral health needs or housing instability, this population may also lack the skills and professional attributes that employers seek. Additionally, employers may be reluctant to hire people returning to the community after incarceration due to liability concerns. Given these challenges and the pressures that One Stop Center face to meet placement goals, the reentry population is not always prioritized for services. Now I'm going to turn it over to Earl Buford, CEO and President of Employ Milwaukee, the local workforce board in Milwaukee County. Earl, can you tell us a little bit about Employ Milwaukee and how does it deal with some of these challenges and competing priorities? And then also maybe speak a little bit about how Employ Milwaukee is unique in comparison to many workforce boards. Earl?
Thank you, Erica. Hello, everyone. Earl Buford, President and CEO of Employ Milwaukee, Workforce Development Board here in Milwaukee County. A couple of interesting things. Ray Woodruff made the point earlier about a perfect storm. And so I'm going to talk about what our board is and does, but also kind of connect the dots on what's happened since the white paper has come out. And I have a disclaimer to put out. I was very fortunate to be a part of the working group that was a part of the original white paper. So Milwaukee County was selected as a pilot project. I couldn't have been more proud and happy of the work, but also showed that there's lots of you're only selected if there's a lot of issues in your area as well. So we have to just be honest about that and roll our sleeves up and go to work. But it's a perfect storm of a lot of things coming together. Ray mentioned the leadership group along with this pilot. So I came on board and took over the local workforce board in 2014. Right around the time when this process was starting to come together. And so a lot of intentional strategy. So as a workforce board, for those of you not familiar, we are basically public workforce systems in various areas. So we are under federal legislation known as the Workforce Innovation Opportunities Act, or WIOA, formerly Workforce Investment Act. And we have some key responsibilities as that public workforce system. So basically we serve as a funnel for those federal dollars that come into an area. We have three key points: dislocated worker services, adult services, and also youth services. And under the guise of our adult services, we operate job centers. In some areas, every area is, I think the number is about 1,800 workforce boards around the country, 11 in the state of Wisconsin, 3 in southeast Wisconsin, where we reside. They are, within our adult services, we also operate job centers, as Erica mentioned earlier. And I think many of you have worked with a job center in your area. You may not understand what that all entails, but in most cases, that is the first stop where someone comes in seeking services. So a couple points. So that's our jurisdictional items as a workforce board. But since 2014, we've tried to develop a strategy that not only help job seekers, reentry and otherwise, in those other buckets that I mentioned, but also become a better advocate for employers and industry. So really looking at a true supply and demand workforce model. One of the things about workforce, I think many of you listeners out there will agree with this, is while we've done a fantastic job of getting people ready to go to work over the years, we've done a pretty poor job of engaging employers. So I think that's been the largest trend in the past 10 years is really how do you engage employers better. You know, whether it's through sector strategies or intermediaries, there's a lot of different terms of how to do that, and we try to incorporate as many of those best practices as possible. So one of our key things when I came on board in 2014 was to really look at a supply and demand model. So one of the first things we did was put together a strategy, not a program, but a strategy that will connect supply and demand together, and we call that Compete Milwaukee, which also coincided with a lot of things that Ray mentioned earlier. And under a Compete Milwaukee strategy, with the local workforce board serving as kind of the intermediary connector, we established a couple of key tenets. One, development of industry advisory boards. You can call them sector boards, you can look at it any way you want, but really looking at the hot sectors in our area and engaging those employers at a high level, one, for job openings, but two, to also help us forecast what their industries and those pathways are going to be, define what they are, and help us connect our resources to responding to those openings. So that was one key thing we had to do on the demand side of the aisle. Second part of that was also implement a situational model known as a job scan. Some places call it needs assessment, some call it other things, but for us, we need to know where the jobs are at. You can't really do workforce if you don't know where the jobs are at. It's a pretty basic tenet, but it's often not followed. So we're holding very strong to try to follow that methodology. So the job scans allowed us to forecast our advisory boards and really pinpoint where the jobs are at. For instance, last time we conducted our job scans, there were about 1,600 openings in local healthcare institutions that we now know, from entry level to middle skills. So just for example. And then within that, it also matches up very well within the WIOA legislation. So you take that with identifying where the jobs are at, lining up resources to connect to those, then also having this model come into play that will really allow us to look at the reentry population in a different way. One, not just that are they returning, but two, setting up strategies to engage them with those jobs that have been identified or those career pathways or apprenticeships as they develop. So really taking a more strategic approach as a workforce system and allowing ourselves to work closer with partners and practitioners who are already on the ground doing this good work and lining those resources up to make that happen. So I'm happy that the screen says supply and demand on a scale, because that's really where we're trying to go with this approach is, how do you go to scale? There are lots of great programs out there. There's lots of great programs in Milwaukee that have done a really good job of getting this population ready for work. But what the goal here is to have it go to scale. And scale means different things in every market. But in our market, it's a large amount of individuals going to work and sustaining work and staying out of the problems that they had before. So really excited to be a part of that. And one of the crown jewels of this model coming together is about 2 years ago, we were recipient of a Department of Labor LEAP grant. And for those who are familiar with that, the first round of LEAP, there were about 10 awardees, and we're all able to set up job centers in our local institutions. In our case, we set up in Milwaukee County House of Corrections. And so we're able to provide pre and post services to individuals aligned with jobs and careers that we've identified through our job scan and through our advisory boards. So pretty cool concept, pretty cool coming together, and we're excited about the scale it's going to achieve over the coming years.
Thank you, Earl, for sharing that well-needed information of the way workforce boards are working with the reentry population to get them ready for employment. We had a polling question up. How many employment service providers have experienced challenges with prioritizing employment services for the reentry population? We'll do a tally of that, and actually we have quite a few people who responded yes. So what I want to do at this point is also turn it over to Tamika Cooley, who's also with a workforce board, but they're located in Palm Beach County, to talk about some of the challenges in competing priorities to serving this population. Maybe she can shed some light to some areas that they've been able to do, such as they also have the LEAP grant as well, to prioritize employment services for the reentry population. Tamika?
Yes, thank you, Erica. Hello, everyone. I'm glad that you also mentioned the LEAP initiative, which is the Lincoln Employment Activities pre-release. The Career Source Palm Beach County was the recipient of the LEAP initiative through the U.S. Department of Labor, which sort of set everything into motion as to how we do this work. Connect people with employment. But when I first started into this position as the program manager at CareerSource Palm Beach County, the idea or the concept of criminogenic risk was sort of an anomaly. So we needed to sort of take a stand back and look at the great work that we already do with other populations with getting employment, but then understand some of the key challenges that this population face as it relates to additional services, and sometimes being not as marketable when they're first coming out of incarceration. So we began to have dialogue, and the IRES project was a had a key role in bringing us around the table, some of our key stakeholders, into discussing this issue and the importance around this work. And then we, from there, understood that employment alone is not a predictor of recidivism, but we did need to look at other needs of the individuals in order to get them job ready. So we decided collectively as an agency that this work was indeed very important. It's a part of, not in addition to the or special project, but it is a part of what we do every day to make sure that we have a skilled workforce, especially here in Palm Beach County. So we decided, yes, to make this a part of our everyday work by adopting best practices in both the workforce development arena as well as correctional programming. And from there, we decided to put together a reentry unit in-house where they are able to, what we refer to as no wrong door. They come, they enter into our facilities. We do what we traditionally do with our universal clients, but if an individual that is coming out of incarceration needs intensive or specialized services, they then are referred into the unit so that we can delve a little bit deeper into those criminogenic risk factors. So with IRES, from there, we were able to even streamline services a little bit more by looking at who is high risk or low risk and more or less job ready, and then sort of sort the services that we provide even further. So we're very grateful to be a part, to have the opportunity to be a part of the LEAP initiative through the U.S. Department of Labor, and also to be a part of the IRES project. Thank you, Erica.
Thank you, Tamika, for providing insight from a workforce board perspective. I'm sure it was extremely helpful to those who are providing employment services for this population. One-stop centers and workforce boards must be engaged in initiatives and goals and committed to considering new ways to build the capacity and better target resources to maximize outcomes for people returning from incarceration who are less job ready. So now we'll transition into assessing risk and needs, including job readiness. So the second question or a huge takeaway when we thought about doing this project was to really think about whether agencies were conducting timely risk and needs assessments and job readiness screening. So here, what we wanted to know was whether risk and needs assessments are used to determine a person's likelihood to reoffend and their associated needs so that correctional programming can be targeted accordingly. And are assessments conducted for everyone who's admitted to prison or jail? We also wanted to think about whether job readiness screenings were conducted to inform referrals to community-based employment programming. So you may ask, why does this matter? Well, matching people to the most effective combination of correctional interventions, community supervision, employment services is really dependent on the use of a reliable, validated assessment and screening tools. These tools can help individuals identify each person's risk and needs and potentially predict the future of criminal activity. Employment programs are well positioned to address risk factors because they have large numbers of people with criminal histories coming into their doors, as Tamika mentioned. And they can provide pro-social environment that can help counter negative peer influences and also reduce the amount of time people spend engaging in antisocial activities. Assessing risk-related attitudes and behaviors not only helps reduce recidivism, but also make program participants more employable. Finally, assessing a person's readiness for work informs what types of services are provided. Okay, folks, we got a pop quiz. Here, what are the top 4 predictors of recidivism? We only want you to select 4. So we have antisocial thinking, lack of education and or employment, family and marital stressors, antisocial peers, past criminal history, antisocial personality, substance use, mental disorders, lack of pro-social leisure time. So you have about 20 seconds to fill in your top 4 predictors. So I think someone brought up that it's only allowing to select 1. We're going to check into that. Okay, so I apologize. It's only allowing people to select 1, but we'll tally the results and kind of get a depiction of where people believe the top predictors of recidivism lie. So this will take about 30 seconds. So there's actually 8 predictors of recidivism, and they can be measured using a validated criminogenic risk and need assessment. If these areas are addressed, they can actually reduce someone's likelihood of criminal activity. By administering risk and needs assessment tools Agencies can prioritize programming to make the best use of limited resources and ensure interventions for people in the criminal justice system are targeted to their individual needs. So while of the 8 predictors, majority of people selected lack of education and employment, that is not one of the top 4. The top 4 is actually shown in blue, where the other predictors or needs are shown in gray. So now I want to turn it over to Ray to talk about how Wisconsin Department of Corrections use risk and needs assessments to inform programming. Ray?
Yep, thanks, Erica. So I liked having that poll, actually. It showed, people, obviously you can only select one answer there, but people were clearly selecting a lot of different factors, and as you mentioned, Erica, one of the top ones that people selected was lack of employment or education. And I think it's sort of telling, right, because a lot of people assume that if you are able to get someone at employment, stable employment, that it will lead them away from criminal behavior. But one of the things that we know, certainly in dealing with this population, that there's all these other factors that are associated with criminal offending, and certainly factors that predict or I guess inhibit one's ability to obtain and maintain employment. So antisocial thinking, antisocial peers, etc. These are all indirectly associated with employment when we're talking about our population. If an individual doesn't think that it's appropriate to get up in the morning and go to work, then they'll find it difficult to obtain and maintain employment. So in a way, employment is related, but certainly in corrections, our focus is on addressing antisocial thinking, antisocial peers, antisocial personality, etc. When we embarked on this project, we certainly had to look at all of the other factors that are associated with individuals that are coming out of incarceration, and then making it so that it's more likely for them to be successful. How the Wisconsin Department of Corrections uses risk and needs assessments, I'll speak mostly to Division of Adult Institutions, so that is when individuals are incarcerated. Neil Thorson will talk to how do we use it in the community. So the Department of Corrections has been invested in utilizing validated risk and needs assessment for some time now. We've used it for many years because really it's the foundation of everything else that you do when you work with a population of individuals who are engaged in criminal behavior. So we've used it for several years at this point, and the way that it works in the Division of Adult Institutions, every individual who comes into incarceration receives a validated risk and needs assessment. We utilize the COMPASS risk and needs assessment tool. And from the needs scales, so only looking at the needs scales, that's where our program assignments come from. So when an individual has elevated needs scales, let's say in the substance abuse area, we assign substance abuse programming. They have an elevated needs scale in the criminal personality scale. Certainly we would assign thinking for a change for that individual. Then once an individual flows through the system, they get to the facility, then the risk level, so low risk, medium, moderate risk, high risk, that's what determines program priority. So even though someone may be low risk, they could have an elevated need in one of those areas, but they're very unlikely to receive an intervention if someone is low risk for a variety of reasons. Number one being we know that it's not appropriate to enroll low risk individuals in programming with other moderate and high risk individuals. So we prioritize all of our programming for the moderate to high risk individuals, as well as we look at other factors, time to release, institution adjustment, these sorts of things, because we have almost 23,000 inmates in the state of Wisconsin, and certainly at any given time we don't have enough staffing capability to provide interventions to all those individuals, but we do our best to prioritize services based primarily on the COMPASS risk and needs scale.
Thank you, Ray, for sharing. As Ray mentioned, he works on the institutional side, and we also have Neil Thorson here, who's on the community correction side with Wisconsin Department of Corrections. Neil, can you share with us how risk and needs assessments are used to informed community supervision services?
Yes, absolutely. Thank you, Erica. Good afternoon, everybody. I really wanted to touch upon 4 areas where I think the use of risk and needs assessments most interfaces with the operations of my staff. And when I say my staff, I mean the probation and parole agents who actively supervise clients on community supervision in the state of Wisconsin. First and foremost, the use of a verified and vetted actuarial assessment tool allows us really to prioritize those risk areas that we just got done discussing in terms of focusing on areas that we know are most heavily contributing to the negative behaviors that is being exhibited by our clients. So with that, then we're able to develop very effective case plans such that we are working off the same sheet of music when it comes to interacting with our clients, and we are investing our time in changing behaviors that we know are driving the overall criminality that has resulted in them being a part of the criminal justice system. Along those same lines, what the risk and needs assessment also allows us to do in the community, it allows us to determine how intensive of a level of intervention the client requires. So if we have somebody who's coming out of the institution who scores on the lower end of the spectrum, that may be somebody that we don't necessarily need to offer as robust of interventions. Conversely, and not surprisingly, someone who comes out of the institution with a very high actuarial risk assessment and need assessment score may be someone that we need to pay more acute attention to, and that's when we start having conversations along the lines of perhaps bringing into the equation some other forms of surveillance and monitoring in order to provide the structure that is needed to ensure that there's not recidivism taking place and there's not a return to the behaviors that led to their involvement with us in the first place. Also, where we've really found value in the use of risk and needs assessment tools is in the area of prioritizing program placement. We have done very extensive research to validate the concept that those that are coming to us on the low-risk end of the spectrum, absent other factors and professional judgment, for the most part really don't require a lot of our services in order to be able to address the behaviors that have resulted in them sitting across the table from us. Whereas those that have higher risk and need assessment scores really are who we want to prioritize for placement and programming. So I don't think Wisconsin is unique in that we do have limitations when it comes to availability of services and budget concerns that we need to take into account. So by having a verified risk and need assessment tool, it allows us to make sure that we're making best use of the services that we can deliver with the resources that are provided to us by the Wisconsin state government. And last but not least, you can use risk and need assessment tools as a continuing baseline when it comes to ongoing case supervision. And what I mean by that is if you have someone who is doing well, there's an opportunity by continuing to reassess the need and risk to perhaps reduce their supervision level, require them to see agents less often, or reward them in other fashions, such as requesting from the court consideration for an early discharge from supervision. On the other side of that coin, though, also the risk and need assessment, having a validated tool helps us make sure that there's uniformity when it comes to responding to violations of supervision. So it provides the agents a baseline and a guide that they can use and refract through the prism of risk and need their decisions when it comes to responding to negative behavior in the community. So again, those 4 areas I think is where you're going to see the highest manifestation of the use of the risk and need assessment tool in the community.
Thank you, Neil, for sharing how community supervision utilizes a risk and needs assessment to inform case planning. Now I'm going to turn it over to Tamika, who's with Palm Beach County Career Source, to really talk about how services are a little bit different in Palm Beach County. In Palm Beach County, the community-based providers actually administer the risk and needs assessment. Tamika, can you share how Palm Beach County uses the risk and needs assessment program and how that information is shared throughout community-based providers?
Sure, Erica. So very similarly to Ray and Neil, our case managers, we do use a risk assessment. Our case managers conduct the level of service inventory, or in short, the LSIR revised. to gauge a participant's likelihood of reoffending, which is a risk score, and we also look at their protective factors as well. From there, we sort of adopted this team model to develop a strengths-based approach to the work, but it helps us to, one, determine the pre-release correctional programming pre-release. So again, and very similarly, if a person is scoring high in, say, antisocial cognitions and or personalities, that person, yes, would be recommended to attend maybe a Thinking for a Change. We also have other cognitive restructuring programming that is available to them. So we would recommend and make that a part of their case plan that they attend that. Secondly, it is used, again, to kind of direct our case planning with the correctional staff, the case managers from our community-based organizations, as well as with the client, so that it is a team approach and everyone is involved and there is buy-in on all sides to sort of direct that plan, both pre-release, extending out to the community. And third, also, it is used to look at the number of dosage hours that will be used in that continuum of care when the post-release, when they are released and they are working with their community-based post-release case manager. So those are three different ways in which we use it here in Palm Beach County.
Thank you, Tamika, for sharing. I know in Palm Beach County, they not only use the LSIR proxy, but in some instances, they're actually able to do the full LSIR pre-release. Yes. And I think we'll talk about a little bit about that a little later on when we talk about coordinated services. So thank you, Tamika.
You're welcome.
So what are the predictors of job readiness and how are they measured? The way employment program and services are delivered varies greatly across the field, and there are typically little standardization in how agencies assess whether or not a person is ready for work. Job readiness is often determined by a person's work experience and various skill sets that make them more or less competitive for the labor market. In reality, people with criminal histories commonly experience barriers to employment, but it's also very much possible for a person who's returning home from incarceration to join or rejoin the workforce immediately upon release, especially if they have extensive work experience and high levels of education and or professional and technical skills. Now I want to turn it over to Earl with the Workforce Board in Milwaukee. Earl, can you tell us a little bit about how Milwaukee defines and measures job readiness across agencies? Earl, are you still there?
Can you hear me?
We can hear you now.
Oh, okay. Sorry about that. I was rattling it off too. Thank you, Erica. Sorry about that, everyone. No, I was saying that, as I mentioned earlier, you know, when you have a multitude of job openings and employers that are at the table, and you have an assortment of job seekers, in particular this population, you have to come up with systems that make sense. Otherwise, it's too hard, as you all know. And you become discouraged, the job seekers are discouraged, and you don't serve the needs of employers. So we've had to come up with a multitude of ways to align these predictors and systems. You know, right now there's about, let's say, 15 to 20 agencies that are really key in all this. We've got some really strong consultants that have helped us pull a lot of these together. I mentioned earlier the LEAP grant and some things on the ground that are happening there. But we have to come up with some systems and services that really make sense to make it easier. So since this is a team approach, I brought in our manager of Reentry, Chantel Jewell, who's going to kind of walk you through what are some of the things on the ground that we're doing right now that are starting to align all of these things. So, thank you.
Okay. So in Milwaukee County, we're currently using the online work readiness assessment, also referred to as ORA, to assess job readiness. ORA is a customized web-based tool that helps improve coordination and delivery of service by helping to more accurately identify barriers. This further allows for the improvement on directing services based on the reports, that we are able to segregate information regarding participants. An example of this is, to date, we have completed 806 ORA assessments in Milwaukee County. From that information, we know that 53% of participants have high school diplomas, 30% have no valid driver's license, 25% have a housing barrier, 30% have a mental health challenge and a self-identified mental health challenge, and construction was the highest identified area of career interest. The proper identification of barriers allows for evidence-based referrals to be made. An employment and self-sufficiency plan is subsequently created that will take into account strengths, barriers, career interests, and labor market information. The LMI helps to frame conversation with participants regarding career pathways, thus exploring opportunities related to education and training. In addition to utilizing ORA, we also rely on the risk assessments that are completed by the Department of Corrections. Through ORA and the risk assessments and information that we're able to obtain from DOC institution records, it also helps us to better identify job readiness.
And as always, we're always looking at other things that are going to help, whether it's, things that relate directly to the IRES model, a little more evidence-based referrals, things like that. Those are all in play at the moment and continue to grow. The objective here is to, again, what I said earlier, how do we get to a scalable approach where a large amount or majority of the individuals returning are able to walk into job opportunities, the correct trainings, or the correct pathways. That's really the goal here, is how do we scale this up? I mentioned earlier, there's a lot of different initiatives that are happening and a lot of great programs, but when can we get to the approach of scale that's needed to really make this a more effective model, but also more effective from the individual, and so that there's not a strong chance of recidivism. So that's just some of the things that are happening right here in Milwaukee. That's the beauty of these kind of conversations. You get to learn what else is out there as well. And our good friends in Palm Beach have done some pretty good things that we've learned about too, and as well as other groups around the country and other great best practices.
Well, thank you, Earl and Chantel, for sharing information about how Milwaukee County assessed job readiness. I even believe more recently Milwaukee County, Employ Milwaukee has began conducting the OWRA pre-release inside correctional facilities. So true merging there of best practices from corrections and workforce, working together, case planning, and really thinking about providing services pre-release that can continue into the community post-release.
Yes, absolutely.
All right, so as a part of the IRES project, we analyzed the risk and needs of those who were returning home from Milwaukee County from 4 correctional facilities of focus. I'm going to turn it over to Ray to have him explain this diagram and let the attendees know what this actually means. So can you not only explain the diagram, but also maybe talk a little bit about how community-based organizations can tailor their reentry and employment services based on the information that's shown in this diagram?
Sure, thanks, Erica. So to back up a little bit, as I mentioned, this project was designed to really integrate our services, and we focused on Milwaukee, primarily because that's where we release most of our individuals who come out of incarceration. We release probably over 2,500 people back to Milwaukee every single year. And so we really wanted to have a strategy that was designed to impact all of those people that are coming back to the community. As I mentioned, we had and continue to have a strong partnership with Employ Milwaukee through various projects, but we wanted to strengthen that through this project. And so what we decided to do was to focus on 4 facilities where we release people back to Milwaukee community, probably at the highest level. 2 of those facilities prisons are in southeastern Wisconsin. One of them is in the Madison area, and one of them is in the Green Bay area. And so what we did is we looked at, for calendar year, I think this was 2015, we wanted to look at the risk and needs of those individuals. And Chantel just mentioned the OWRA as a job readiness screener. Well, that is not what we used to come up with these figures. What we used to come up with these figures was the risk and needs from the Compass Risk and Needs Assessment tool. So risk is pretty self-explanatory. And then what we looked at was the vocational educational needs scale embedded within Compass. And that asks questions about like past work experience, high school, GED, attainment, do you find it difficult to maintain employment, those sorts of things. And so elevated scores in that scale would lead us to believe that someone is less job ready. And so when we looked at the numbers, we clearly see that about 50% of the people that released from only those 4 facilities back to Milwaukee were categorized as higher risk, less ready. This certainly is a significant portion of the population that's coming out to the community. So what we'll see here in a few slides, I think, is where community-based providers are, like currently, and what they're prepared to deal with and who they're prepared to serve. By just taking a snapshot here and by just looking at the population, we're really able to understand where do we need to focus most of our resources. What we'll see a little bit later is there's a lot of agencies, employment agencies, that are typically better prepared to handle the lower risk, more ready population. But as we see here, that's really a small percentage of the folks that are coming out of incarceration back to Milwaukee. What we need is an integrated system that's prepared to deal with individuals who not only are they higher risk, not only do they have elevated scales in antisocial cognition or antisocial peers, but they're also really not ready to enter the workforce, right, for whatever reason. Maybe they have no job history, they have no marketable skills, they don't have a GED, HSED, they're just not ready to enter the workforce. And so we need to share this information broadly, and as Earl keeps talking about, you know, really bring this to scale and have everybody at the table understand this is the reality of the population that's in the community. And the more we're able to do that, the better we think we'll be able to serve the population in Milwaukee by bringing up the capacity of local community-based agencies to work with this population, by shifting potentially resources in the Department of Corrections, which we have done. It was touched on that in community corrections, we've actually contracted with Employ Milwaukee to come in to these 4 facilities and conduct the OWRA prior to release. So we're all in on this strategy. We are fully invested in this to where we want Employ Milwaukee, the community-based providers, to be able to serve this population appropriately. So it's clear that individuals who are coming out of incarceration we all knew that they probably had high levels of need, but this really crystallized it for us as we went forward.
Thank you, Ray, for sharing. And one of the things I would add to this is when we did also analysis of Palm Beach County, Florida, we had very similar results where we found that majority of those who are returning home from incarceration were at a higher risk to reoffend and less ready for work. So now we'll transition into question number 3. Have we conducted a comprehensive process analysis and inventory of employment services provided pre- and post-release? And as Ray mentioned, it's really good for communities to really think about what services they provide in the community, what services are provided within the institution, and where there's some areas of overlap and also where there's some areas where there's gap in services. So in order to do an analysis, you not only need to look at your correctional institutions and the services they provide, you need to look at the community supervision side, you need to look at your reentry community-based providers, and then your workforce development agency. And you need to look at, from the point of admission to a correctional facility, how people are enrolled in services, and then how they also are enrolled and referred to services even as they transition to the community. This would really give you an understanding of various points of the referral decision and intervention processes. This analysis could include a review of processes related to the timing of screening and assessments, as we talked about before. Also looking at their data collection strategies, referral and enrollment processes, the reentry planning process, or also some communities call it release planning. You look at the community supervision and also those community-based programming referrals and eligibility criteria. So in order to do this, you have to conduct interviews with key stakeholders and practitioners. You need to know what those services are and where the areas are needed for improvement. You need to assess the intensity of the services that are available, as well as what services are available just in general. And this is essential to understanding the assets and the gaps that exist in communities. So let's talk a little bit about what this looks like in practice. What services are delivered should really be based on a person's level of job readiness. So for a more job-ready person, you really want to focus on job development, coaching, retention, and advancement services. Where a less job-ready person, you really want to focus on soft skill development. And in this area, I think someone mentioned, or a question was about transitional job programming, and we'll definitely get to that question. But for low-ready, less job-ready people, transitional job placements will probably be best suited for that person so that you can help them work towards being more employable and able to give them feedback on their performance during this transitional process. So how services should be delivered really should be based on a person's risk to reoffend. So we know that there's basically 5 service delivery principles that are evidence-based. That's engagement, timing, incentives, coordination, and structured time. The way these services are delivered should differentiate. If a person is less likely to recidivate, we don't necessarily need strong or intensive community supervision. For a high-risk person, you will want to have more intensive community supervision. Also, if you're servicing a low-risk person, you want to avoid interrupting any existing pro-social ties, where a high-risk person would need more structured pro-social environment. So let's look at an example. So we have 2 gentlemen here. We have Joseph and Michael. Joseph is 28, has a felony conviction, and also has a GED. Michael is 27, also has a felony conviction, but has a high school diploma. They look pretty similar on paper. So let's see what happens when we administer a risk and needs assessment. We know that Joseph has no prior convictions, maintained ties with family while incarcerated, where Michael has a few more complicating factors. He has 3 prior convictions, a history of substance use, and also has some criminal thinking patterns. So now let's layer in the job readiness assessment. So when we took a look at the job readiness assessment, we know that Joseph has employment prior to arrest and also worked while incarcerated, whereas though Michael was unemployed at the time of arrest, has spotty employment history and limited work skills. So now we're going to open the polling, and I really want you guys to think about, based on our conversation thus far, where Joseph will fall in terms of these groupings that are listed. Grouping 1 is lower risk to reoffend, more job ready. Grouping 2 is lower risk, less job ready. Grouping 3 is higher risk, more job ready. Grouping 4 is higher risk, less job ready. And we'll give you guys a few seconds to put in your polling. And we'll ask you to look at, for Joseph, what would the results be. Okay, we'll close the polling at this time and begin to do a tally. And this will take just about a few more seconds. So the tally is in, and we have for Joseph, lower risk, more job ready. And your answer is correct. For Michael, we found him as higher risk, less job ready. So when we look about services for both, we know that Joseph, we're going to really work with him in terms of connecting him to employment and really focus on retaining employment. He wouldn't need CBI programming to address criminogenic needs because he's at lower risk to reoffend. Whereas though Michael, who's at a higher risk, less job ready, would probably need more services, more intensivist services, maybe some that focus on soft skill development. Also, he would need work around getting him more employable. So this may be opportunities for education and training, maybe some vocational training, maybe even a traditional job placement. So in the essence of time, we have a little less than 15 minutes before the webinar. I'm going to move kind of quickly through the next few slides, and we're going to open it to Q&A really soon. So when we took a look back, and Ray mentioned this about assessing the services that are provided pre and post-release, and what he mentioned was very significant to our findings in this project. When we took a look at all the employment services that were provided in the community, and we look at what services were provided and then how they were delivered, we found that majority of the community-based organizations were really better equipped to serve low-risk, more job-ready people. And then when we looked at, in comparison to what majority of the population looks like, where we said 50% of those who are returning home are higher risk, less job-ready, there was really only one agency that was really equipped to provide services in a meaningful way that included evidence-based practices and really was geared towards reducing recidivism. So we worked with both sites. We found this very similar in Palm Beach County as well. And we worked with them to really think about how can we build the capacity of the providers. We provided professional development opportunities and partnered with National Transitional Jobs Network, also the National Institute of Corrections. We also worked with the agencies individually to really think about the way that they deliver services. And at this time, what I want to do is really turn it over to Neil to really talk a little bit more about the partnership between DIA, DCC, and Employ Milwaukee, because I believe that was a key factor in terms of really ensuring that evidence-based practices to reducing recidivism were in place.
Thanks, Erica. So I think it's important to kind of paint a picture as far as how we want this process to work in Milwaukee. As was referenced prior, the idea is that we will get lists in advance of individuals who are scheduled to be released from the 4 facilities that Ray identified for the next 6 months. Those lists will go directly to the reentry coordinators from Employ Milwaukee, with whom we have established contracts. So they'll be able to sort of plan ahead and determine how much time they'll need to dedicate to each facility. And then once those lists are received is when we'll bring the agents into the conversation with the stated goal of having the agents have to do the least amount of paperwork possible. That's a big issue for our agents here in Wisconsin. So really all we want to do is let the agents know that your client's going to be involved in the pilot project, and all we need from you is one document to get that rolling. However, we will not wait for that document to be received by the agent. We'll expect it's coming. In the interim, the employment coordinators from Employ Milwaukee will commence that in-reach And in some facilities, it will look like this. The employment coordinators will go directly to the facilities and conduct face-to-face online work readiness assessments with the clients who are soon to be releasing back to the community. In two other facilities, which are a little bit farther geographically speaking from Milwaukee proper, we will be conducting that same process, but doing it through video conferencing. So you'll still have an opportunity for the employment coordinators from Employ Milwaukee to build rapport with the clients that they will be serving upon return to the community, but it will allow for a little bit more of reduction in the amount of time that the staff need to spend driving back and forth between the institutions. So the idea is that then that online work readiness assessment that has been referenced throughout the presentation will be completed in advance of the client's return to the Milwaukee community. And they will also have access to the program that is utilized by the Department of Corrections to monitor some of the programs that Ray referenced and the degree to which programs were completed in the institution to address the criminogenic needs. So it's really going to provide an opportunity for partnership and a strong transition and continuity of interventions, such that if there was a criminogenic need that was identified as a priority in the institution, the reentry coordinators from Employ Milwaukee are going to know that. They're also going to know if the client has addressed that need through programming, if more programming is required, and then they can have that conversation with the agent. So everybody then is involved in that case planning process and making sure that the criminogenic needs that are most prevalent are addressed. And it really helps too in the context of we're able then to match, and this is the main point of the project, the clients with a job readiness program that is most appropriate for them and provides them with the best opportunity for success. And I think real quickly it's important to provide a little bit of context here. When I was an agent, we didn't have anything like this. So if I was looking to refer somebody to programming, my referral probably was going to be based on who I had a working relationship with, who was maybe closest to my office, who recently came and presented to me at some sort of meeting. Whereas now we're sort of removing that responsibility from the agents. We're not requiring them to be up to date on all the current programs that are available in the community. Rather, we're putting that onus and responsibility with the folks that I think are most equipped to be up to date and do that as part of their work anyways, which is the Workforce Development Board or the reentry coordinators from Employ Milwaukee. So really this is allowing the agents then to focus on different sort of interactions with the clients at office visits and not having to spend time doing additional paperwork and making the outreach and knowing what's going on the community provider level and what new grant projects perhaps are going on in the Milwaukee area. So I think it's really going to be a nice synergistic relationship that we're going to see between the agents, DAI institution staff who are focused on reentry, and then the coordinators from Employ Milwaukee with whom we've developed these relationships.
Thank you, Neil, for sharing it. And one thing I also wanted to add, and we talked a little bit about the community-based providers and kind of where they fell. There will still be referrals to community-based organizations. Employ Milwaukee will do a referral process. So as they receive services in-house, if there's an opportunity to make connections with a community-based provider that has services that could best suit the needs of the reentry population, they'll also be referred. So the last question is really talking about a coordinated process. And before we get into that, I'm going to ask everyone to just type in their questions at this time, and then we'll start moving towards addressing those questions relatively quickly. At this point in time, what I really want to do is turn it over to Tamika Cooley with CareerSource Palm Beach County to really talk about the coordinated referral process in Palm Beach and how the intermediary agency, the Criminal Justice Commission, is used to really connect people to services pre-release for post-release services. Tamika?
Hi, can you hear me? Hello?
Yes, we can hear you.
Hi, okay, awesome. I don't know what happened there. The Criminal Justice Commission in Palm Beach County sort of functions as the lead coordinating agency to ensure that people are connected to the necessary programming to meet their reentry needs. For the purposes of this project, we are focusing on employment programming. So the CJC coordinates with the community providers as well as the institutions. And at most Florida Department of Corrections facilities and the county jails, people are referred to programs that they should connect to upon release. For our Sago Palm, which is our dedicated reentry center here in Palm Beach County, providers have the opportunity to provide the InReach, where they are going in, again, adopting that team model along with the client and correctional staff to develop case plans and also to coordinate that seamless transition back to community. So that's the way that the criminal justice here sort of serves our reentry population and how they sort of serve as the hub to those services going out to our community providers.
Thank you for Tamika and sharing. What we found, it was very unique in Palm Beach County where they already had an intermediary that kind of looked in partnership with the community-based organizations, brought them together, do case planning, think about assessments and referral process, enrolling people in services, connecting with them pre-release, which we know is highly effective in terms of keeping people engaged and enrolled in services post-release. And then they also have a database system where they track individual outcomes. I think Tamika mentioned earlier about tracking dosage hours, so their system that's in place is actually going to be able to do that. So at this time, with just 4 minutes to spare, we're going to open to questions, and I see quite a few people have put in a few questions, and they've been answering the questions as they go along. One of the questions that was mentioned that we didn't touch a lot on was how is the offender included, or are they to be included in the reentry planning process? So I think that this may be a good question for community supervision. Neil, would you be able to speak a little bit to that, how on the community supervision side people are, who are involved in the system are connected to services and involved in the process?
Sure. So the way it works in Wisconsin is that 6 to 9 months prior to an individual's release from an institutional facility, the agent and the social worker who is assigned to work with the client while they're in the institution schedule a series of phone calls and video conferencing interactions whereby the social worker, the agent, and the offender all meet and talk together about the client's goals for reentry and allow the client to articulate what they hope to accomplish upon their return to the community. And some of that dialogue informs the case plan in so much as the agent and the social worker and the offender work together to identify tasks that they would like to accomplish underneath each case plan area, as well as barriers that they foresee, and then that allows an ability to engage in a dialogue about how they're going to collectively work together to overcome those barriers. So it really is an interactive process. Although they're not sitting down in most instances face-to-face in front of each other, we really do try to make it as dynamic as possible. And I think, as I mentioned earlier, adding the reentry coordinators from Employ Milwaukee into that mix will just be another voice and another opportunity for the clients to get feedback and advice about how they can structure their time in the community in the most productive fashion possible.
Thank you, Neil, for sharing that information and answering that question. There was a question about any experience with transitional job programs, and if so, any advice on successful structure. And I do know in Wisconsin, they actually have a transitional job collaborative that is going on there. Would Neil or Ray be able to really speak to transitional job programs in Milwaukee?
Sure, I can talk a little bit about that. That's sort of an area that is ongoing and developing as we speak. We have had several recent meetings with those in the community that do provide traditional job programming, because what we really want to see is those agencies working together along the same lines as the underlying philosophy of the IRES model, in that we would like them to develop an idea about who they're best equipped to work with. So I think that's very important. And then real recently, we were able to bring in a subject matter expert in the area of transitional job programming, wherein we invited those providers in the community to come and listen about strategies that have known to have been effective in and around the country. And that was very well received, I think, by our community providers. And it was also insightful in that some Department of Corrections staff were able to attend because we don't have a lot of knowledge or experience in transitional job programming. So it really, really helped us to all unite in terms of how we are going to approach this important tool moving forward and integrate it into the IRES pilot project.
And Erica, this is Earl. As Neil mentioned, there's a lot of good conversations happening. There's a couple on-the-ground projects, as you're aware, where we were able to marry some of the state's investments in transitional jobs along with the local areas, and particularly the city of Milwaukee's investment in transitional jobs and also acting as an employer. And so there's some models around that as well that have been pretty progressive. So I can, you can share my information later with others. I can talk to them offline and talk more in depth on that. I know we have a lot of time to do that, but the Transform Milwaukee meets Compete Milwaukee model has been pretty strong and leveraging with all the things we talked about earlier.
Thanks, and thank you, Earl, for jumping in on that. And this is a perfect segue because there's a question about the process of connecting employers and really talking with them about the advantages of hiring people with criminal records. Could you shed a little bit, Earl, on maybe some of the strategies, and maybe even Tamika could jump in on this as to how you engage employers and kind of reel them in terms of hiring this population?
Sure, and I'll answer two ways, from a private sector standpoint and also from a public sector. So I'll start with the public, and just piggybacking off the transitional jobs piece. So what we were able to do with the city of Milwaukee, and actually Milwaukee County as well, through their Parks Department, is really put together some sophisticated things that work with a couple of their initiatives that are focused on reentry. There's a pretty strong fatherhood initiative as well that's been working with that, and through the Parks Department, some other infrastructure needs. And the city of Milwaukee is also, past 3 years, have set aside about 200 various positions. A lot of them public works, some at the Port Authority, some at the Department of Neighborhood Services, where they've done two things. One, align those job requirements, and we serve as employer of record for this population, but also where they've invested in the city budget to connect to the state's investment. So basically, instead of having a minimum wage job situation, it became a livable wage of almost $11 an hour for 6 months worth of work. So pretty innovative from a public sector side of this. From the private sector side, again, working with the employers up front, you're able to analyze what the jobs are, but also analyze their attitudes. So we feel pretty strong about, we know not only who's willing, because sometimes that's important, who's willing to do it, but also what makes good business sense when you're developing talent. Who's involved from a training standpoint, who's involved from a apprenticeship development standpoint, most importantly, who's involved from a talent development standpoint. And so having employers involved up front gives you a better lens into who wants to do it and who has the need to do it.
Thank you, Earl, for providing insight on that. I would say we are having a webinar coming up, and if you guys take a look at the NRRC website and subscribe to our monthly newsletter, which is posted on the slides, you'll be able to register for that workshop or webinar that will really speak to engaging employers and working with this population. Us at the Justice Center, and also as a part of the NRC and through various efforts such as IRES, we've been working with businesses to think about the hiring decisions and also how to include them in the process of getting people more employable. So we're a little over time, and what I want to do is just thank everyone for joining the webinar. I want to thank Deanna Hopkins, Earl Buford, Tamika Cooley, Neil Thorsten, and Ray Woodruff for taking the time to speak with us today about the great work happening and the great work that's underway in Milwaukee County and Palm Beach County. And I want to thank everyone who submitted questions. I apologize if we didn't get to all of your questions. However, my email address is listed there. If you have any specific questions around the IRES model, if you're looking at implementing this model and want to get stakeholders excited about doing a collaborative and coordinated approach to reentry and employment services, reach out to us. Let us know what your experience are, where you are in the process, and how those 4 questions we just talked about today, where you are in that process there. So after this webinar, you'll receive an email with a link to a survey asking you about feedback for today's webinar. Please take a moment to fill this out, as it will help us to continue to improve the resources we provide to the field. We'll also email a link of the recording for today's presentation, as well as a link to the PDF of the PowerPoint slides we viewed today in the upcoming weeks. These links will also be made available on the National Reentry Resource Center's website, also csgjusticecenter.org/NRRC. I encourage you to sign up and really take advantage of all the resources the NRC has to provide. Thank you all, to the panelists, to attendees, to those who asked questions. Have a great day.